Chairman Smith, and thank you, Mr. Secretary, for being here today. West Virginia has the highest mortality rate in the country for patients with kidney disease. I have focused much of my energy on the healthcare space on advocating with patients who have chronic kidney disease, ESRD, and I'm glad to be able to discuss these issues with you in the past. Last year, I led a letter with Congressman Blumenauer about the need for a pediatric ESRD modifier within the ESRD payment bundle, and I was very pleased when your agency took our advice and created one. I'm excited to see how this improves child care, or children's care with ESRD. I also led a letter with Congresswoman Del Bene about the need for Medicare coverage of home dialysis for patients with acute kidney injury. Many patients with AKI are at the beginning of their kidney disease journey, and studies show that almost 50% of the patients with AKI never regain kidney function. Ensuring that these patients have access to home dialysis from the start is critical to helping them remain on home dialysis down the road if they do develop ESRD. Just last week, this committee heard a powerful testimony from a home dialysis patient about the absolute life-changing potential of home dialysis. For these reasons, I'm concerned by CMS's decision not to allow home dialysis for patients with AKI, which does not seem aligned with HHS's overall goal of increasing home dialysis uptake. All patients, including those with AKI, deserve the opportunity to decide, along with their clinical team, what dialysis modality is right for them. How are you working to ensure that CMS policies around AKI patients are aligned with HHS's overall goal of increasing home dialysis?
Congresswoman, thank you for the question. And by the way, thank you for your deep work on this issue, because for many folks, and it's not a large community, this is life and death. And so thank you for the work that you're doing. We're talking about, we have to make sure that when we're extending access to some of these services through the Medicare or Medicaid programs, that we do it right, because taxpayer dollars are involved. We have to make sure that we're focusing correctly. On this particular issue, we've been taking comment from the AKI community, and we will continue to do so. I will take back your comments today to our folks at CMS so we can follow up with your team if you'd like. We're not done, and this is an issue I know you're not going to stop working on, and we'll try to get there, because what I think we all understand is that at the end of the day, the quicker and better we get services to these families, the less it's going to cost taxpayers.
And I do appreciate your commitment to kidney disease patients, and I thank you for working with me. In West Virginia, about half of Medicare beneficiaries receive coverage through Medicare Advantage. Your department recently cleared a CMS rule that is waiting for White House approval that would overhaul the Medicare Advantage enrollment process. This committee's been engaged on this issue. 14 members, including myself, sent you a letter on January 12th on the proposed rule. Like you, we are concerned about bad actors and aggressive marketing practices that cause headaches for seniors. We also believe seniors need resources to decide which plan to enroll in, but your proposal would limit resources in the enrollment market for everyone, not just bad actors. Would you commit to me that CMS will not reduce enrollment resources nor limit the ability of agents and brokers to help beneficiaries find Medicare Advantage plans that do fit their needs the best?
Congresswoman, let me commit to you to work with you on that issue. Now, one of the concerns we have is that we want to make sure that people are steered to the plans and services they need, and we want to make sure that at the end, it is in the benefit of a patient that they end up in a particular type of plan or service. So more than willing to work with you to address that, because I think you and I both have the patient's interest most in mind.
Thank you. Mr. Chairman, I yield back my time.